Welcome again, Facebook friends, to Get Healthy with Dr. Cooper live on Facebook and YouTube. You know, a couple days ago, the world celebrated International Women's Day. And I thought it best to do the show on women's health as we celebrate a woman. Now, men, sons, uncles, if you're listening, don't go away, because education is empowerment. So even though the show today is dedicated to women, straight talk on women's health, I want everyone to listen, because you can help others as you gain information. Remember, this show is designed to educate and empower you through information that you can learn to change your lifestyle. So before we continue, I'd like you to share. Spend some time right now and share this page with your friends, because I have a very powerful show lined up for you. So take some time and share, and remember to like the page, subscribe. You will only be empowered with the information you learned. You know, 2 weeks ago, I asked you to share and comment, and I wanted to see who did the most sharing and commenting. So 2 weeks ago, Marcia Scott, she won a book. This is the book, 14 Days to Amazing Health. In this book, I've outlined healthy recipes, healthy, easy exercise, and information on meditation for you to change lifestyle. In this book, I have a lot of testimonial from my patients who have followed this program. Some have gotten off their medication, some have decreased medication, improved blood pressure, improved their diabetes. So I want you to comment, like, and share the page, and you might be the next winner. Now, I want to congratulate Miss Day, Agnes Day from New York. She won last week because she had the most comments. So if you want to, obtain one of these books, then like and share the page. Share the information. I'm your host, Dr. Donna Cooper-Dockery. I am board certified in internal medicine. I've been practicing medicine for over 27 years. I enjoy taking care of patients. But most importantly, obviously, I enjoy giving patients education so they can take charge of their health. So I like to teach and educate. I also enjoy giving free services to those that are in need. I like to go on an international trip 1 or 2 per year. I just got back from Ghana, where we served over 3,000 people. So I want you to like, share the page, comment, ask questions, and you might be the winner for this week. Now, before we continue, I'd like to share a very important event that we're going to be having here in South Texas. It's going to be the first Health and Wellness Summit in South Texas, to be held April 11th, all day. So if you're living in South Texas, I would like you to make plan to attend. If you're not living in South Texas, then you can also be part of it. Just get a plane ticket and spend some time with us and enjoy this beautiful area, South Texas. As we continue the show today, you will meet Anthony. Anthony Gomez is the marketing director for Cooper Internal Medicine, and he has been working with his team to put this event together. So I want you to stay until the end of this program so you can meet Anthony. And of course, our special guest is Dr. Chandela J. He is a very difficult name. You're going to be meeting him. He's going to be discussing different aspects in women's health. So don't go away. At this time, I'm going to put on our video advertising the Health Summit, and then you're going to help me welcome Dr. Chandela.
Why are some cultures living longer than others? Could the answer be found on your plate or in your lifestyle? Find out Wednesday, April 11, 2018 at Get Healthy RGV, Health and Wellness Summit in McAllen, Texas. Register online now at bit.ly/GetHealthyRGV. That's bit.ly/GetHealthyRGV. Receive free medical screenings and enjoy healthy, flavorful cooking demos, samples, and more. While you're here, plan to attend the Continuing Medical Education Conference. Hundreds of healthcare professionals, health coaches, chiropractors, and dietitians from across the country will descend upon McAllen, Texas for one day only. CMEC 2018. Get insight from top nutrition and health experts and industry leaders. Network with hundreds of healthcare professionals and earn continuing education credits. Save the date, Wednesday, April 11, 2018. Get Healthy RGV, Health and Wellness Summit, McAllen Convention Center, located at 700 Convention Center Boulevard, McAllen, Texas. Stay informed about the benefits of good nutrition and a healthy lifestyle. Let's change the future of healthcare. Use lifestyle as we add years to life and life to years. Register online now at bit.ly/GetHealthyRGV.
Well, welcome back to Get Healthy with Dr. Cooper. You know, this week it was International Women's Day, and I decided to address women's health. However, ironically, I have a male OBGYN to speak about women's health. What do you think about that? Dr. Jen, welcome to Get Healthy.
Thank you, Donna. Thank you for your invitation.
Tell us about yourself, where you were trained, where you're practicing currently.
I am a physician in Edinburgh, but I wanted to take a second to congratulate and celebrate all of our women, our mothers, sisters, wives, and children on the important day of International Women's Day. And
Thank you.
I'm glad for the invitation so we can talk about this. As I say, I'm a practicing board-certified OBGYN in Edinburgh, Texas. And I practice full-service gynecology and full-service obstetrics. So basically we see women anywhere from the age of at birth to postmenopausal women.
Very good. Well, thank you. You know, you're very special to me, Dr. Jen, because we have done some humanitarian job work all over the world. We have been in Ghana, in Senegal together, and in Haiti together. So you are very special.
Absolutely. I feel the same.
So as we address straight talk on women's health, you know, in my practice, I sometimes see ladies who are so scared and frightened when they're told they have a fibroid. Is this something we should worry about? What are fibroids anyway?
All right. Fibroid is one of the most common tumors of the wall of the uterus. It's commonly referred as scientifically referred as leiomyoma, and a fibroid contributes to heavy bleeding, can also contribute to urinary frequency, and oftentimes cause back pain. Unfortunately, those symptoms are very common in some women, but with the combination of bleeding, urinary frequency, and back pain, then ultrasound should be done to look for a fibroid.
Very good, very good. Now, are fibroids pre-malignant? Should they be worried about cancer? Because women are so conscious about having cancer. So they come in the office and they say, hey, I have a tumor, and they're scared. Are they precancerous?
Actually, most fibroids are not malignant if they are fibroids. But the problem is that usually you don't know it is a fibroid until you remove it and send it to pathology. We have a good system of evaluating it based on the ultrasonic features on the ultrasound, and based also on the patient's history and the patient's age, that this may not be a malignant tumor. Oftentimes, fibroids will not go and progress to malignancy, but there is a 1% chance that they convert into something called leiomyosarcoma, which is the version of cancerous fibroid. So the best thing to do if you have heavy bleeding and you have pain and you have what we call a uterine mass, whether it's a fibroid or something else, you should consult with your gynecologist.
Very good. Let's talk about the location of these fibroids. I know that they can be outside of the uterus, within the muscular wall of the uterus, or in the mucosal lining. What are the symptoms or the dangers in relation to even fertility when they're at different locations?
Excellent question. And so those fibroids can be what we call intramural fibroid, where they are in the wall of the uterus. They can be submucosal. Mucosa is the lining of the inside of the uterus, so it gives access to inside the uterus, which is the endometrium.
Right.
Those are the ones that impact more fertility. They can cause miscarriage, and they can cause bleeding as well. The other type of fibroid would be called subserosal, and those are the ones that protrude inside the abdomen.
Right.
So, and also you can have fibroid in the broad ligament, which is outside even the uterus.
Right.
And there is also a very rare disease where you can have fibroid all over inside the belly called leiomyomata disseminata, but that's very rare.
That's too complicated, that word.
That is true.
All right.
Now, the submucosal fibroid is very special because that's the one that will cause infertility and causes bleeding, and is very amenable to therapy. I know we will talk about therapy, but we'll segue into the therapy part, and that will basically is amenable to therapy via something called hysteroscopic resection, which is where we put a camera inside the uterus and we can remove it. So you can remove those without having a hysterectomy.
All right, let's talk about a young woman. So a young woman that is told that she has fibroid, what would you say to that woman in terms of treatment?
There are several treatment options which span from medical treatment and as a minimally invasive treatment. So the treatment options for fibroid, let's take fibroid in general. You can, it depends on the patient's symptomatology. If the patient is just bleeding, and the patient is not interested in conceiving at that time, then it is better to use oral contraceptive, hormonal products that will decrease the patient's bleeding.
Right.
If the symptom is pain and the patient doesn't have irregular bleeding and the fibroid is small, I would say less than 2-3 centimeter, and then you can also use pain medicine to regulate the pain.
Right.
Now, if it's someone that has a submucosal fibroid and had successfully carried a pregnancy, and this is discovered between the pregnancies, probably I would recommend to remove that fibroid, so you don't go through the pain of having a miscarriage from that fibroid. And the results are very good. Also, for the young women that have fibroids and have not conceived yet, then we have options such as myomectomy, which is removal of the fibroids. That traditionally used to be done on an open way through a big incision, but now with the technology we have, we can do it in a minimally invasive way. Whether it is with laparoscopy, or some of us that are trained in robotic surgery also can remove it that way.
Very good, very good. So ladies, if you're told that you have fibroids, don't panic. There's so many treatment options. If you're young and you want to conceive, then as Dr. Jen suggested, the fibroids can be removed or you can be placed on anti-contraceptive therapy. If you're older and you are not considering having children, then, and you're having heavy bleeding or a lot of pain, then the option is pain medication or even hysterectomy. So usually fibroids are not necessarily malignant, even though Dr. Jen said small percentage could lead into carcinoma. Right. So don't be afraid if you're told you have fibroid. There are many treatment options for you. Don't go away. We'll be right back with more on Straight Talk on women's health. Ladies, if you have fibroids, as I said, don't be scared, because as you just heard, fibroids, these are the most common benign tumor in women. So just make sure you go to your doctor so the doctor can treat you appropriately. Let me take some time to welcome some of our guests. I see Perla Nieto here, Juana, Chuy, Percy from the Philippines, Susana Salazar, Agnes Day. I see Susana Salazar again. Yes, I mentioned her. Rosemary Redray, my sister in New York. Remember to like and share the page. I think the information you're receiving, this is vital information to preserve good health. Remember, the program is dedicated to women. However, we need the men on the program as well, so you can learn how to help the woman in your life to stay healthy. The wise man Proverbs in Proverbs 31 said, "Who can find a virtuous woman? For her price is far beyond rubies." Ladies, you are virtuous. Please share this page. And remember, at the end, if you share and like, then I have a gift for you. 14 days to amazing health. This is packed with pearls of how to stay healthy for life. So share and like her page. And I want to invite you to our upcoming event, our Health and Wellness Summit here in the Rio Grande Valley. At this time, we're going to go over to our videos so you can get all the information you need to sign up for this event that will be held April 11th.
Why are some cultures living longer than others? Could the answer be found on your plate or in your lifestyle? Find out Wednesday, April 11, 2018 at Get Healthy RGV, Health and Wellness Summit in McAllen, Texas. Register online now at bit.ly/GetHealthyRGV. That's bit.ly/GetHealthyRGV. Receive free medical screenings and enjoy healthy, flavorful cooking demos, samples, and more. While you're here, plan to attend the Continuing Medical Education Conference. Hundreds of healthcare professionals, health coaches, chiropractors, and dietitians from across the country will descend upon McAllen, Texas for one day only. CMEC 2018. Get insight from top nutrition and health experts and industry leaders. Network with hundreds of healthcare professionals and earn continuing education credits. Save the date, Wednesday, April 11, 2018. Get Healthy RGV, Health and Wellness Summit, McAllen Convention Center. Located at 700 Convention Center Boulevard, McAllen, Texas. Stay informed about the benefits of good nutrition and a healthy lifestyle. Let's change the future of healthcare. Use lifestyle as we add years to life and life to years. Register online now at bit.ly/GetHealthyRGV.
Welcome back. If you're just joining us, I am talking with Dr. Jen, a board-certified OBGYN, on Straight Talk on Women's Health. We just celebrated International Women's Day, and I thought it was very important to talk a little bit about women's health. We just ended on fibroids, but we're going to move right on to obesity and pregnancy. You know, if you listen to my show, you'll realize that my focus is on how to prevent chronic diseases, whether you're pregnant or not pregnant. But since I have Dr. Jen, who's an OBGYN, we're going to talk a little bit about obesity and pregnancy, the risk for diabetes in a pregnant woman. Dr. Jen, you're in South Texas. Tell me a little bit about diabetes in pregnancy. Do you see a lot of that?
Yes, unfortunately, you know, we are in one of the most obese part of the country. We have our population that is 90 to 96% of Hispanic heritage, which predispose most of our population in the area to diabetes. That risk factor compound, that genetic risk factor, we have not done anything wrong. There's a predisposition that God has given and that has been compounded throughout years of eating
or lifestyle.
and lifestyle. That contributes enormously to the development of diabetes. And in pregnancy, there is another risk factor that women have, and that is derived from the placenta. which is called something called human placental lactogen, or HPL. This hormone makes the woman more diabetogenic.
Wow.
So hence, if you're in South Texas and you already have the genetic risk factor of risk factor of diabetes, and you have you have obesity, and on top of that you're pregnant, hence most of those women will go on and develop gestational diabetes. So we see gestational diabetes a lot in pregnancy.
Yes. So you're saying that in South Texas we have a high incidence of diabetes just because of genetics. Now I also believe that you can tweak your genes. So not necessarily because you are predisposed to diabetes, you're going to have diabetes.
Absolutely.
However, you're seeing patients who are predisposed to diabetes. They are obese, and therefore that increased the incidence of diabetes in pregnancy. Doctor, at what time during the pregnancy do you check for the blood sugar? You do the...
Wonderful. That's a good question. We pick on South Texas because we live in South Texas, but I know your show is international.
Worldwide.
It's watched worldwide,
Yes.
everywhere in the world.
Yes.
Then gestational diabetes does not discriminate.
Right.
So, and this goes for just about everybody else. So if you morbidly obese, if you have genetic predisposition, if you have Hispanic, African American, or Native Indian background, or you have a pregnancy with a history of gestational diabetes, or a family history of diabetes, which is pretty much, you will say, 75–90% of the world population.
That's right.
Then you should be screened into the first trimester of pregnancy as early as possible. How do you screen? You give a glucose load in the office and you check a 1 hour sugar. And if that number is more than 140, we know that you have you're at risk of gestational diabetes. Now, based on that test, then we will do a diagnostic test, which is spent for 3 hours, and to see how much you clear the sugar at 1 hour, how much you clear at the second hour, and how much you clear at the third hour. Now, if you have two of those numbers that are above average, then you consider to have gestational diabetes.
Very good, very good. Ladies, did you hear that? In your first trimester, you should be screened for diabetes. You're going to be given a glucose load, and then the sugar will be tested at 1 hour, sometime at half an hour, 1 hour, 2 or 3 hours. If you have two abnormal values, then you will have gestational diabetes. Dr. Jen, how do you treat gestational diabetes? Do you treat them with pills or insulin?
That's a very good question. The old, there's a classification. First of all, diet.
Of course, lifestyle.
And exercise.
Right.
Lifestyle changes. Not every woman that has gestational diabetes will need medication.
Correct.
Let's get that clear. Actually, half probably will not need any medication if that's hence early intervention.
Right.
Which is what you usually talk about, which is prevention.
That's my show.
It's better to cure disease. It's better to prevent disease.
That's right.
So if we can prevent those women from coming into pregnancy with diabetes, then we are successful.
That's right.
And I tell you what, women are special. And since this is a Women's Special Day,
that's right,
God also has given women an early signal warning for diabetes.
That's right.
And men do not have that. Because if you have gestational diabetes, you have a risk of getting diabetes later on, 10 to 20 years.
Yes.
And guess what? We do not get pregnant, so we don't know.
Imagine that.
So I like to tell my woman, you know, God really loves you for showing you this diabetes, which is not going to stay with you after the pregnancy if you take the right steps.
That's right.
If you take the right steps.
Good, good.
So treatment, diet, lifestyle changes first, and we monitor your blood sugars. Now, if your blood sugars are not corrected, then we go on to medical therapy. Right. In the past, we used to go straight to insulin, but now we can use pretty much all the other drugs that are safe, which is metformin and glyburide. And we use metformin a lot, especially in our patients that have polycystic ovarian syndrome, which is one of the risk factors of diabetes, and which is very prevalent also, which we can talk about on a different day if we have the time.
Right, right.
Now, lifestyle management, even, I tell my patient, even if you're on the medicine, even if you're on the insulin, you still have to do your lifestyle management.
I agree.
Otherwise, we just increase the dose.
Right. It makes no sense.
And it makes no sense.
You're listening to us. That's why we have the show Get Health with Dr. Cooper, because the focus is to show you, everyone, how to use lifestyle, healthy nutrition, exercise, stress management to prevent and to treat many diseases. Ladies, if you're thinking of getting pregnant and if you're overweight, the first thing to do is to change lifestyle and lose the weight. If you don't lose the weight, then you're at risk for diabetes in pregnancy. If you have diabetes in pregnancy, then the baby is at risk for many, many different complications. Yep. So it's better for you to take control of your health, lose some weight, get pregnant, and have a healthy delivery. Don't go away. We're going to be right back with more on Straight Talk on Women's Health with Dr. Jan. Ladies, I hope you're listening, and I want to take the time to welcome two men that I see listening. I have here Curtis Brooks. Welcome, Curtis. You've always been following us. I also see Al Ortiz. Welcome, Al. And there are other ladies on the show. Mrs. Carnes, welcome. Tamika, my niece from New York, welcome. Juana, Agnes, again, you're here. I want to get you down here to be on the show, Agnes. Cynthia Lemon, welcome. Helen and Milo, and all of you that are watching, I'd like you to share and comment. If you'd like us to discuss a topic, then put me a message. You know, we're discussing women's health, because one of the listeners asked me to discuss a topic that was relevant to women. And then I broadened it to women's health, given the fact that we just celebrated International Women's Day. So I want to shout out to all the ladies there that you are special. You were created special. And that is why I have the show. Men, you're also special. And I will also do another show on men's health in general. I want to remind you of our upcoming event that is going to be held here in the Rio Grande Valley, April 11th. I spoke with Anthony, who is the marketing director for Cooper Internal Medicine. He heads the team that is organizing this special event. The special event is sponsored by Cooper Internal Medicine, Get Health with Dr. Cooper, also by our local medical school, UTRGV, and the residency program here in South Texas. But if you're not living in South Texas, remember, this program is for you. Just go online and see all that we're offering, including CME Continuing Medical Education. We want you to use healthy lifestyle to prevent, reverse, or improve chronic diseases. At this time, I'm going to ask the producer to put on the interview with Anthony Gomez. Well, today in our studio, I have a very, very special guest, Anthony Gomez.
Hello,
Anthony,
everybody.
Welcome to Get Healthy.
Thank you, doctor. Thank you for having me.
You know, over the last several months, you have been very busy.
Yes, very excited. We're very excited at Cooper Wellness Center.
What have you been busy doing? First of all, tell us about yourself.
Well, my name is Anthony. I have a background in exercise sports science. I'm certified through the National Academy of Sports Medicine. I've worked with various ages from youth to older adult, helping them achieve their health and fitness goals. Currently, I'm working at Cooper Wellness Center with Dr. Cooper. We help within the wellness programs, the health and wellness programs that we offer, and we have exercise sessions that we do throughout the week. We're also doing an outreach for community health with this next summit that we're having.
Right. So you've been busy. You are the marketing director for Cooper Wellness Center.
Yes.
And you have been tasked to organize the first Health and Wellness Summit in the Rio Grande Valley. Am I right?
Yes, doctor.
Have you been excited doing this?
Yes, very excited. Very excited also meeting all the wonderful people of the Rio Grande Valley, those dedicated to bettering the quality of life of the individuals that live here in South Texas.
Very good, very good. Tell me, What is the summit and when will it be?
So our summit, the Get Healthy RGV Health and Wellness Summit, is taking place April 11th, Wednesday at the McAllen Convention Center.
Very good.
It's a free event to the public. We're inviting all age groups from youth to older adult. We'll be offering free medical screenings. We'll have live action-oriented activities. We'll have demos, cooking demos, fitness sessions, some great speakers lined up for you all. We'll also be having a seminar stage that you can check out, free to the public as well, different topics that will be covered
Very
throughout
good.
the day.
Now, I'm sure people might be asking, what is a summit? You know, here in the Rio Grande Valley, people are probably exposed to Health Expo, but this is a health summit.
Yes.
What's the difference between an expo and a summit?
Well, you know, many of us have been to expos. We've been to health fairs. Usually what that entails is usually just booths, free products for the public.
And free screening.
Yes,
Right.
free screenings. Well, a little bit what we're going to really be pushing for and promoting is education first.
Very good.
Education.
Education. And the emphasis is on lifestyle, using lifestyle as medicine.
Yes.
Because we know that, for example, here in the Rio Grande Valley or worldwide, a lot of people are dying from lifestyle diseases, diabetes, hypertension, obesity. So the goal of this summit is to educate the public on how to use healthy lifestyle to reverse diseases. Now tell me, Anthony, what do we have for the healthcare professional, whether the doctor, the nurses, chiropractor, health coaches, what do we have for that sector of people?
Yeah, so let's start off with the networking session. We're going to have a networking session that takes place before the whole event kicks off. And that's for everybody that's involved in the summit. So whether they're a booth exhibitor or they're a sponsor, they're invited to our networking session. The purpose of that is we really want all of our businesses that have a like-minded mentality of bettering the quality of life within the Rio Grande Valley. We're really wanting to showcase the local businesses that are there that have that purpose, and that's another reason for this summit. So the medical professionals are also, our main target is the CME conference.
Right.
Yes.
So we're having doctors from all over the United States there. We're having our main speaker will be from Loma Linda University. He is the former president for the American College of Lifestyle Medicine. That's Dr. Wayne Dysinger. He will be speaking on food as medicine and in general using lifestyle to reverse diseases. So if you're a healthcare provider, a nurse, or anyone who just wants to learn how to use lifestyle, then this conference is for you.
Yes.
And Anthony mentioned CME. So if you have to get your continuing medical education, then you need to sign up for this. Now, what about other people, the general public? Why should they be there?
Yeah, so like we said earlier, we're having free medical screenings. Whether you're just wanting to see where you're at currently, or let's say you're not feeling too well, we will have medical professionals present. It's a good time to see where you're at, check your vitals. We will have nurses as well, students as well, taking vitals and different type of screenings.
Right, so there'll be screening for high blood pressure, there'll be screening for diabetes, there'll be screening for body fat content, lots of screening. So we want to invite the Rio Grande Valley public to the McAllen Convention Center, April 11th from 8 to 6. There's something for all of you, everyone in the Rio Grande Valley. If you're on a lot of medication and you want to learn how to reduce medication, come out. If you're diabetic and you want to improve, come out. If you have high blood pressure, come out. If you have no medical problem, but you want to educate yourself so you can teach others how to improve their health, then this is for you. Anthony, I know you have a lot more to say, but we're going to take a short break.
Yes.
And then we'll return with more information on who are we working with, who are our sponsors. Don't go away. We'll be right back. Thank you, Anthony.
Thank you, doctor.
Yes, I just want to thank Anthony for the work he's doing with the summit. Remember, today we're discussing straight talk on women's health. I took a short segment to invite you to the Health Summit. Let me take some time now to welcome some other people that joined us. I have Marlene Cooper from Jamaica, my sister. I have a cousin who I just learned of in England, Pauline Hogg Mackey. Welcome. And I want to share my the show with others there in England. Ronita Chance, Asenet, welcome. I want you to remember to share and like her page and comment. Ask for any topic you think that would be good for the general public to know. And remember that I take time to answer all the comments that you write. Let me go back to Dr. Jen as he discusses women's health. Welcome back to Get Healthy with Dr. Cooper. Today we're talking about women's health. We just celebrated International Women's Day and I thought it best to talk about women's health. But I brought a male OBGYN who knows a lot about women's health. He sees a lot of women in his practice. We just ended on gestational diabetes. But another problem I see in my office that I refer to the gynecologist is vaginal bleeding. I'll see young women coming in with prolonged menstrual flow or older women with vaginal bleeding. And a lot of time I need to know what is the cause of this vaginal bleeding. Doc, can you tell me something about vaginal bleeding? I know this is a wide topic and I'm sure you see that a lot.
Absolutely. It is a wide topic, but I think we can break it down. It's like as a thing in simple pieces. One, we can divide it in those causes that causes irregular bleeding and those that cause regular vaginal bleeding. So the normal menstrual period should last you 5 to 7 days. I like to tell my patient if it's more than 10 days, then it is abnormal. And if you bleed in between cycles, it is abnormal. Then an evaluation should be performed. Now, when you reach menarche, which is like when you reach your age of having your cycle, which is about 13 average in the United States, but now as women get like bigger and more precocious, then we see more precocious puberty, and those women will have their cycle earlier, around 9 years of age. Now, between 9 and age 16, what we like to call the pituitary axis, which is the brain talking to the ovary, because there is a flow of hormone in your body, and whenever that hormonal sequence is disrupted, then there is results. That's why it is important to maintain a balance. To if you have stress, you know, we know that women, when they move into a different home with another woman, their cycles harmonize. So those are just miracles that we don't have explanation of yet, but we think it has to do with the hormonal cycle. Now, if you have irregular bleeding at that age, usually we watch it. You know, we rule out basically coagulation disorders, coagulopathy, because usually this is the first time the woman have a major episode of bleeding. They may have something blocking them to clot. So usually before age 16 that should be found. Now, but usually we just hold hand with those young women. You know, sometimes we have to put them also on birth control pill if they don't have a blood disorder, and regulate their menstrual cycle until they can auto-regulate it by themselves after age 16. Now, then we have other irregular reason for irregular period, such as thyroid dysfunction, such as prolactin dysfunction, and all of those have to do with the pituitary axis. And then we have people that are born either with no ovaries, with ovaries less performant, and then also can have ovarian disorder to regulate their menstrual period. Now, then we move into things that can cause irregular menstrual bleeding. Those are the women that have the heavy bleeding. You know, usually it has to do with fibroids. We talked about fibroid. Or there is something that can increase your bleeding called polyps, uterine polyps, which are like growth that are inside within the uterus. So, and they're very amenable to treatment. Also, you can have something called polycystic ovarian syndrome, which is a complex topic, but if you break it down, those women have irregular bleeding. They can have hirsutism, and they can have like darkening in the neck, and those women are predisposed also to diabetes, which is two topics we talked about. Sometimes it's predisposition, sometimes it's something that women will gain due to, you know, obesity and due to the way that they eating.
Right.
So,
did you say the way they're eating?
yes,
Let's
absolutely.
talk about that. This
Right.
show is on Get Healthy.
Right.
And it means that we need to eat healthily. So can you explain to me how food choices can affect women and cause irregular bleeding?
Absolutely. So food choices, you know, I mean, you're the expert in this, but I'll tell you, fresh food, you cannot beat fresh food.
All right.
I think we all think we're a physician, and we know that why probably people lived longer lives before rather than not having antibiotic and advanced medical care.
Right.
That's because they were eating fresh. Fresh from the field. Now we know that the food that we're eating have a lot of preservatives, and I'm sure you've addressed it in your show.
In my show.
And also the foods are also very rich in carbohydrates
And saturated fats.
and saturated fat. And some of these diets, like original diets, any original society you will go to, you will see this, you know, whether it's African, whether it's American Indian or Hispanic, that the diet is very rich in polysaturated fat and also rich in carbohydrates. That was because there was no mechanized motor type work, you know, like cars, i.e. like electric machine, to do the work. You used to do manual labor.
Right. So they were
and in order to do
exercising.
manual labor, you were exercising.
Right.
Now that we have car that moves us everywhere, now we have everything that is like Wi-Fi or mobile
Right, so we
or
don't move at
motorized,
all.
then we don't move at all. Hence the impetus of changing the diet, of eating less saturated fat and less carbohydrate, and eating a balanced diet.
Good.
Which is the most important thing. The other thing for women that have irregular bleeding, a diet rich in iron, because we know iron is the substrate that will form hemoglobin.
Right.
And hemoglobin, and then with hemoglobin, with iron, then we will have blood.
Right.
Otherwise, we won't have blood. Now, food rich in iron, I'm sure you
Green
have a
leafy
long list.
vegetables, it's
Yep.
a long list. If
The
you keep watching,
beans.
yeah, the beans
Yep.
and the beets and
Yep.
the spinach.
Absolutely.
All these are really good in iron.
In iron.
Whole grains are great in iron. So if you're a woman and you're having irregular bleeding and your doctor has addressed the problem, then you just need to change your diet.
Absolutely.
All right, Doc. Now, you know, I have some older ladies that will show up to me. They haven't had a period in a year or two,
Right.
but they have heavy bleeding. When I see those patients, I get concerned and I'll
Yes.
send them to you.
Absolutely.
What are some of the diagnoses in an older woman that we need to be aware of that can cause irregular bleeding?
Once you reach the age of what's called menopause, which is age 50, and you don't bleed for 1 year, afterward you should not bleed. You can have spotting for that 1 year until the cycle stops. Sometimes also that irregularity in the menstrual period can happen like the year preceding to menopause, which is between age 45, even earlier, 30. Those are called premature menopause.
Right.
But once you hit menopause, you should not be bleeding. So it's called postmenopausal bleeding, and it should be investigated. And we always worry about malignancy, cancer. Now, that's not every postmenopausal bleeding that is cancer. It has to be evaluated. We have endometrial biopsy sampling. We have minimally invasive way to look in the uterus these days, whether with ultrasound, whether with a little camera, and take directed biopsies, or look at what is causing this bleeding. Oftentimes, it's a lone polyp.
Right.
You know, that stayed there, and you remove it, and that's the end of the story. The treatments are not very difficult. You know, you can put intrauterine devices like IUDs with hormone that can decrease the bleeding of this woman, or they can take oral treatment, you know, Premarin, to get rid of it if it's like endometrial hyperplasia. Oftentimes, though, the woman will need surgical intervention.
Alrighty.
And at that time, after you finish your conception years and you have abnormal bleeding, and If the biopsy shows that you're at risk of getting an endometrial cancer, then it's better
To remove the
the
uterus.
uterus prior to cancer.
Very good. Thank you so much.
And we do not remove the ovaries until age 62.
Really?
Unless there is cancer.
That's right.
Because we still need the ovaries, because the ovaries, believe it or not, most women think that the ovaries is just to produce estrogen, and once you reach menopause, you don't need them anymore. But the new dictum shows that the ovaries produce other hormones, that support your intellectual ability,
Right.
still support your bone
Right.
metabolism, and also support your, give you a small amount of estrogens that you
your
can
body
build on
needs.
with natural estrogen to feel comfortable and transition through menopause.
Excellent. We're going to take a break. Very interesting topic. Ladies, we're doing straight talk on women's health with Dr. Jen. Don't go away. We're going to take a break. We'll be right back. Thank you, Dr. Jen. I want to take some time to welcome some people that have just joined. I want to welcome Farron from Jamaica, Michael Wilson, Zakia Ringgold, Rose Deniser, Mons Garza, Marlene Cooper, and all of you that have just joined. Remember, we're talking about women's health. I'd like you to share the page, like, and make comments. I will be looking at the end of the program to see those who have shared most or have most comment, and then this book, 14 Days to Amazing Health, will be yours. Last week, Agnes Day from New York won this book. The week before, Marcia Scott was the winner. So you might be next. So like and share the page with others. We're discussing relevant information for you as a woman, for your daughter, for your cousin, and for you men to be able to help the women in your life. So share the page, like, and don't go away. We have a special event coming up in the Rio Grande Valley. It is Get Healthy RGV Health and Wellness Summit, the first one in the Rio Grande Valley, and we're asking you to support us. At this time, I'm going to go to a video that will tell you how you can support and how you can sign up for this summit.
Why are some cultures living longer than others? Could the answer be found on your plate or in your lifestyle? Find out Wednesday, April 11, 2018 at Get Healthy RGV Health and Wellness Summit in McAllen, Texas. Register online now at bit.ly/GetHealthyRGV. That's bit.ly/GetHealthyRGV. Receive free medical screenings and enjoy healthy, flavorful cooking demos, samples, and more. While you're here, plan to attend the Continuing Medical Education Conference. Hundreds of healthcare professionals, health coaches, chiropractors, and dietitians from across the country will descend upon McAllen, Texas for one day only. CMEC 2018. Get insight from top nutrition and health experts and industry leaders. Network with hundreds of healthcare professionals and earn continuing education credits. Save the date, Wednesday, April 11, 2018. Get Healthy RGV Health and Wellness Summit, McAllen Convention Center, located at 700 Convention Center Boulevard, McAllen, Texas. Stay informed about the benefits of good nutrition and a healthy lifestyle. Let's change the future of healthcare. Use lifestyle as we add years to life and life to years. Register online now at bit.ly/GetHealthyRGV.
Welcome back to Get Healthy with Dr. Cooper. Today we're talking about women's health. The topic is Straight Talk on Women's Health with Dr. Jen. We looked at different topics: polycystic ovarian disease, diabetes in pregnancy, irregular bleeding, but there's so many things to talk about. This time we're going to talk about a big topic that I'm sure you're listening about: hot flashes, postmenopause. When does it come? How to treat it? Dr. Jen, I have a lot of women who come to my office with hot flashes, irritability, inability to sleep. Tell me a little bit about how do we deal with the postmenopausal symptoms?
Absolutely. Well, it's a huge topic, but menopause is a natural transition for
Natural
women.
cycle.
So at age 50 or so, women will go into a period where they will stop bleeding. That herald the menopause years, but it doesn't stop there, as most women know.
No, it's miserable.
So just all of those symptoms that you've described, like the hot flashes, the memory loss,
Right.
you know, the irritability, you know, and it's just not women that suffer from this. Sometimes their partners also,
the man. It affects the man too.
Absolutely, and the entire family
Right.
structure. So it is something very important to address. Now, we do have solutions.
Good.
That's the good news.
There is hope, ladies.
There is hope. And most women used to be on what is called hormone replacement therapy in the past after menopause, and in large amounts. And about 10 to 15 years ago, there was a study, the woman health study, that came in and basically stated all of these things, that the woman will have cancer, they will have blood clots, heart attacks, and everything. But as years came, we figured out that the amount of estrogen that was given orally was too much.
Right.
And as we all know, and that's what you advocate all the time, balance.
Balance.
Everything we need to do, we need to take balance into consideration. And as OBGYNs, we've recognized that, and the doses have decreased significantly. And now the way to treat medically menopause will be to use the least amount of hormones available to ward off the woman's symptoms.
Very good. What about duration, Doc?
The duration of therapy is something that you will have to do for a lifetime, because you won't make estrogen. But guess what? Some women just need a transition. They just need a transition through the first 3, 4, 5 years after menopause, and they tell you, I'm fine. The hot flashes are gone, you know? And we have alternative nows with things, because, you know, as you well know, menopause is just not only the hot flashes. We have vaginal dryness. We have the bone metabolism, osteoporosis. You know, we have hair changes, hair loss. We have memory lapse, and all of those things. So each one of those, there is treatments that are available. Now, there are also natural treatment.
That's right.
That are available.
I usually suggest natural treatment. You know, black cohosh, it's believed to be a natural estrogen, and then I suggest patient go ahead and get the natural. And sometimes I use antidepressant as well.
Absolutely.
For patient with these postmenopausal symptoms.
And they do work, and to the woman, because that's not every woman that can take estrogen therapy. So when you have your consultation with the gynecologist, if you have an astute gynecologist, they will take your risk profile, your cardiac risk profile, history of blood clots in the family, your previous estrogen use, and tailor for you the right hormone replacement therapy.
The right treatment.
Now, we also have natural estrogens now, which is what you hear in the news, the new word bioidentical therapy.
Right.
Bioidentical hormone, which are hormone estrogen synthesized from plants and from yams. And in my practice, we have pellet therapy, which is a pellet, it's a tic-tac, you know, which can be inserted for women. And not only it will boost under the skin, and it will boost not only your testosterone, and it will boost also your estrogen therapy. I think that will be the future for estrogen therapy in women. Currently, it's a little bit expensive, but as time goes, and I think most women use it, the prices will go down. And since it is compounded medicine, you know, there is differences in quality.
Right.
So it is very important to have the right partner, the right lab furnishing for you, the right type of estrogen and testosterone pellet to insert for this woman. But it's the results are great, because you maintain what's called steady state.
Right.
Rather, the oral were the one blames in the studies. And you can still use oral, but at low doses. I have many of my women on oral estrogens.
Yes, I
and
do.
And also on vaginal cream.
Right.
And they do very well with that at just low doses. Now, there's a portion that have a lot of problem with irritability, a lot of problem with memory lapses, a lot of problem with like lack of sexual desire, libido.
That's a big problem.
And which is caused by, most of the time, I like to tell my woman, it is just not a lack of hormone. There's a lot of this factor. So when you come and you present with lack of sexual desire, lack of libido, then again, if your doctor is astute, will ask about as a side, the social history,
So the
your
history
family
is very
history, and the
important, yes.
history.
And you
Is
just
history
you tailor your
and
treatment
tailor
according to the
patient.
history.
Absolutely,
Right. Because if
absolutely.
a patient has breast lump, for
Right,
example,
right.
then I'm not going to put that patient on hormone replacement therapy.
Absolutely.
Because of the increased risk for that lump to increase in size and maybe become malignant.
Right. I agree with you. As long as we it's a good step to take. Definitely don't start anything until that lump is biopsied. But once we know that the lump is biopsied and it's negative, then you can enjoy also hormone replacement therapy. But it's prudent. Every woman that needs to have hormone replacement therapy needs to have a mammogram
I agree.
and a gynecological evaluation. Because if you still have the uterus also, there's the risk of developing endometrial cancer because
Right.
the estrogen increases.
the growth.
Yes. But then that's when you combine with the progestin.
Right.
Now, there are solutions.
Always. There's always
There
hope.
are solutions. There's the antidepressant that you mentioned, which work great on some women that are not candidate for
Right.
hormone replacement therapy. But again, everything goes back to what we were saying. I mean, you need to change your lifestyle.
Right.
You have to adopt a new lifestyle as you're going into this different phase of your life, and less stress,
Right.
you know, and eating well, you know, because your midlife years of like heavy exercise when
Yes.
you were young, those things maybe you may not be able to do. Then you have to compensate with it with your diet and doing like more soft exercise like yoga, biking, gardening is a
Even
great
just
exercise.
walking is great.
Is great
And just
exercise.
relaxing, get up early in the morning and walk.
Absolutely, and meditation.
And meditation. You know, Dr. Jen, studies have shown that ladies who are on a plant-based nutrition, ladies who consume a lot of tofu or soy products,
Absolutely.
tend to have less symptoms from menopause.
That is
So
true.
if you don't want to have the hot flashes and the irritability, I recommend a plant-based nutrition with soy product. Dr. Jan, it has been a pleasure having you here. And I hope to see you at the Health Summit, you know, on April 11th. We here in South Texas are planning a health summit. It's the first health and wellness summit. But we want people from all over the United States and the world to attend. We have CMEs, continued medical education, and we are going to be having lecturers from Loma Linda University, from Andrews University, from Dallas, and from here at our UTRGV School of Medicine. So as you listen to us share this information, and will I see you at the summit?
Yes, you can count on me. I will be there.
Excellent.
I think it will be a great community event.
Yes.
We invite all of our patients, family members, and the community at large to join this effort. That's the first one,
That's
right?
the first one in the Rio Grande Valley.
That is great.
We're
We
gonna
thank
be-
you for bringing that kind of event to
Thank
our
you,
area.
thank you. We're going to be promoting healthy lifestyle as the solution to chronic diseases. You can't afford to miss it. Dr. Jan, it has been a pleasure having you here, and I'm sure the audience want to hear more about breast cancer, cervical cancer, endometrial cancer. These are topics we haven't even touched. Osteoporosis. But we can't do everything in 1 hour. So I thank you so much for coming.
Thank you, Donna.
Looking forward to seeing you again. Thank
Appreciate
you.
it. Thank you.
Bye-bye. We'll be right back. See, I was so excited there. Let me take the time to welcome some of you who have just joined. We're coming to the end of the program. Victor Wells from the Bahamas, I want to welcome you. Old-time friend Clinton Porter, welcome, and everybody that took the time to join us. I would like to thank you, and I want you to share, like our page, because we have very important information that you can use or you can help others to stay healthy. I have Anthony, who I spoke with earlier on the summit. So at this time, I'm going to listen to Anthony as we discuss what's coming on in April 4th, April 11th. Hi everyone, if you're just joining us, I'm here with Anthony Gomez. Anthony Gomez is the Director for Marketing for Cooper Wellness Center. And also he leads the team that is planning this Health and Wellness Summit in the Rio Grande Valley. Now, I was just speaking to Anthony recently, and he was telling, we were discussing our partners. Who are our main educational partners in this summit?
Yes, so we have the UTRGV School of Medicine, we have the College of Healthcare Professions, and we have the University of Montemorelos as well.
Yeah, so let's go back to the School of Medicine here in the Rio Grande Valley. So we have a School of Medicine, and they will be participating with us. We have the residency program, Preventative Medicine Residency Program. The director will be one of our speakers. Doctors Hospital at Renaissance, they're the one that will be approving the CME. So if you are a healthcare provider from anywhere in the world, then plan to be there. Here in the Rio Grande Valley, the weather is going to be beautiful in April, and we also have South Padre Island close by. Yes. So if you want to take a short vacation, you come for the CME on Wednesday and stay for the weekend and have vacation. So we want to invite all the medical professionals all over the country. Plan to be there, and you will find the link for more information on this same screen. Anthony, what about local businesses? Do we want them there?
We definitely are very excited that local business will be showcased in this Health and Wellness Summit. We very much want the community to know what their resources are in their goals to achieving a healthier life. And we will have not only booths, but we will have action-oriented activities as well present. So there'll be, nutritional seminars, cooking classes, spiritual talks, lectures as well. We'll have live fitness sessions.
What about finances?
Yes, we will have a section on health finance as well. That is a very important subject to be covered.
All right. So we're covering many different areas, as he mentioned: relationship, nutrition, exercises, medicine, healthy finance. A lot of patients or people, if they're not financially stable, that could affect their health. So we're going to be having financial counseling. Anything else we'll be having?
Yes, so we will have a seminar stage that is also free to the public. It will be on all day. There's going to be various topics being covered. Just a few things to say is we will be having workshops on nutrition and fitness. We will have a workshop on preventing and treating back pain as well.
Very good.
So expect to learn something. Walk away from this event learning something to apply to your daily life.
Very good. So we're asking the local businesses to come out. Come and advertise your business.
Yes.
Come on and serve the community. You will have a link that you could get more information. So who are the people that we want at this summit?
Anyone related to health and wellness, medical. We really want people who are striving to better any type of person's life, whether it be through health, through finance, through nutrition, through exercise. We really want people to know that these are resources that they can count on. Most importantly, they are for the betterment of the lives in the Rio Grande Valley.
So I would say everybody should be there. So if you're not ill, but you want to learn how to stay healthy, then the summit is for you. If you want to help others learn how to be healthy, it's for you. If you're a healthcare provider, it's for you. If you're sick and you're tired of being on a lot of medication, the summit is for you. If you're a business owner, the summit is for you. We want to have thousands of people there. So come out and join the summit. Anthony's available for any information you may have.
Yes.
We have a website that will be displayed there, the link. You can find the information you need. We want everyone to support the first Health and Wellness Summit to be held when?
April 11th on Wednesday from 8 a.m. to 5 p.m.
Very good. So please come and support us. All the proceeds from this summit will go back into the community. If you're local and you live right here in the Rio Grande Valley, you realize that over the last 2 years, we have been having yearly Get Healthy Mega Clinic. These clinics are very costly, and this event is intended to raise funds to support the Get Healthy Mega Clinic. You know, last year, 1,200 people received dental care, vision care, and general medical care from our mega clinic. The year before, 1,400 people received care. The services we gave last year was about $5 million. The year before, about $6 million. So we're serving the community. So I want to invite you, whether you're here locally, whether you're nationally or internationally, whatever you can do, come to the summit, come and sit in the seminars, get your CME, or come and just get general education. So I want to invite everyone to come out to McAllen Convention Center, April 11. Anthony, anything else?
Everybody, if you can please look at the link on our website. It's going to be located on your screen. If you have any questions, if you want to see more about what we're about, check out our website. And like I mentioned before, it's free to the public.
Yes.
So please invite your friends, family. This is an all-day event.
Right, free to the public. Guys, you can't afford to miss it. We will see you there. Thank you. Thank you, Anthony, for being here.
Thank you, Dr. Cooper. Great seeing you. Thank you.
Bye-bye. I want to thank Anthony for the hard work that he's doing. And I ask all my patients, all my friends on Facebook, and everyone to support our summit. The medical community, business community, support us, because the idea is to educate the citizens here in the Rio Grande Valley that they can use lifestyle as a means of improving health. Ladies and gentlemen, as we wrap up, I want to thank you for staying to the end of the program. Remember to watch, remember to like the page, share the information, because this is vital information that will preserve life. And if you have in mind any special topic that you'd like me to discuss, then send me a message and I will consider the topic. I want to leave you with a Bible text. It is found in Philippians 4:6-8. You know, last week we discussed, is the doctor treating the real cause, realizing that many people have psychological problems, negative emotions that they experience during childhood or in their life that have influenced their illnesses. But here it says, be anxious for nothing, but in everything by prayer and supplication, with thanksgiving, let your requests be made known to God. And the peace of God, which surpasses all understanding, will guard your hearts and minds through Christ Jesus. So remember, there is always hope. Let's not be anxious, but let us have faith and meditate. I'll see you next week. Please like and share. Bye-bye.